All right, welcome back to Newsgang. And ladies and gentlemen, before we took a break, we mentioned about the crisis in the health sector, because that really is what it is, Jamila. Over the last couple of days, we have seen the nurses and clinical officers down their tools to causing paralysis in most public health institutions. And I think, is it 2 or so hospitals closed since this started, and there could be more, because I mean this is happening in different counties. 22 the last time I checked.
Yes, Joe. One of the hospitals is Kapkatet Level 4 Sub-County Hospital in Kericho. I know this because
I was born there. Did you have to start
there.
with Kericho? Yeah. Anyway, you can
Nikwetu. Yeah, so it's one of the hospitals that have been closed. It was closed yesterday. So patients who live around that area have no health center, no hospital to go to. And you talk about the nurses and the clinicians going on strike, and we need to understand what their demands are. What are they asking for? They're asking for payment of 30,000 shillings risk allowance for all nurses. They're asking for payment of delayed salaries. They're asking for free compensation, comprehensive medical cover, declaration of COVID-19 as a work occupational health hazard, employment of 7,000 nurses in the fight against COVID-19, and inclusion of the Health Service Commission as part of BBI. That's the politics of it. And that is what they've been asking for. And, you know, Joe, and we need to remember that they did not just wake up one day and say we are going on a strike. They had asked for, they had made their demands time and time again, said tunaenda mgomo, wakasemeshwa, stopped again, then they say they're going on strike. And when they realize that no one is listening to them, now the strike has gone on. And this is day 4. And we're already seeing the despair and the agony for hundreds of people who depend on those public health facilities for medical care. In the first day of the strike, I think it was in Bungoma, we were seeing pictures of people going there looking for service, and there was no one to help them. They were stranded. And there was one who was a cancer patient who goes to that hospital on a regular basis expecting treatment, and he went there and he was told, hakuna huduma hapa. And remember, doctors have suspended their strike for 14 days. The talks are going on well from the stories we watch, but remember, doctors cannot work without nurses. Doctors cannot work without clinicians. They cannot work without laboratory technicians. Those are the people who you meet first when you arrive at a health center, not the doctor. Before you fika kwa daktari, muuguzi pale takes your temperature, checks your weight, asks you all these questions. So by the time you go to the doctor, that information is already there. So without nurses, without clinical officers, without the lab technicians, there's a problem. And we're seeing it right across the country. In most places, that kuna tatizo. And county governments, they're saying, oh, we are looking at a multi-agency approach, that across 47 counties, there are few issues that seem to be common along, some of the demands that they're making are common for the 47 counties. There are several of them. Oh, we are looking at a multi-agency approach. But for me, when I hear some of the leaders talk about how warudi kazini, that it's not about you, you have to take care of wagonjwa during this COVID-19 period. But even them as individuals, they're suffering. They're people who need to be listened to. Yes, we need them in the front line against COVID-19, but let's not forget them. Then there are people who have needs, who have families, or people who depend on them. And what they're asking for really, Joe, is not really unreasonable.
But also, I think, Linus, there's been this attitude that really predates 2010 constitution, that strikes and all this industrial action is illegal, it shouldn't happen, and you keep hearing all these statements suggesting that. I mean, in spite of the fact that these things are now generally protected in the Bill of Rights if you give the requisite notices and that sort of thing. And it is interesting that for as long as you and I have been in this field, we have been talking about medical workers, health workers in this country, and it's almost the same story. They're the same demands that they have, and then they'll be dismissed, they go on strike, and somehow something small is done, and it never ends.
Joe, there is growing contempt for industrial action. There is a lot of contempt for workers' grievances. That has been happening especially in the last few years. And what informs this is the growth of an arrogant and very insensitive political class. Insensitive in the sense that they can't really connect with some of the issues that are out here. How are teachers treated when they went on strike? The same way the doctors are being treated today. The medics, that include nurses, clinicians are being treated today. There's a lot of official contempt for industrial action. Now, there are a number of things that, Joe, the country is having to deal with right now. And that is the irony of a demotivated health sector, public service, public health workers, at a time we need them at their best. You know, not long ago, there used to be some Wednesdays when people would clap for our health workers. What happened to the clapping? Clapping died away because clapping doesn't pay bills. Clapping is a good sign of appreciation, but it has to go beyond that. When you look at success stories elsewhere that include Italy, Spain, France, Portugal, and England, where COVID really ravaged in the early part of the year, what they did was, first of all, to make all the workers in the public health sector to feel motivated, to feel appreciated. I don't have details of whether that was made in form of financial remuneration, but at least they felt they were being supported. Now, Joe, just the other day, Governor Ojamong said the health workers, doctors, nurses, should persevere a little bit until BBI is passed. This is arrogance. This is insensitive. Then there was a statement by ODM leader Raila Odinga appealing to the doctors to be more understanding. It goes on quite well until he makes reference to the economy. The economy doesn't apply to doctors alone. The economy doesn't apply to nurses alone. It should also apply to politicians who are right now, and this is the criticism being thrown at government right now, is, you know, you're proceeding at full speed to a referendum that is supposed to cost an estimated 14 billion shillings, and you're asking doctors, you're asking medical personnel to be understanding. You know, go to those places, just understand. It's the economy. I think that is difficult. The last point, Joe, that I need to make is the silence of President Uhuru Kenyatta. This is really tragic. COVID-19 is a big leadership issue. President Akufo-Addo of Ghana was frontline really most of the year on the COVID response. Next door, President Yoweri Museveni has really been present on the issue of COVID-19. Now, we have President Uhuru Kenyatta conducting a number of public functions, including today, and making absolutely zero reference to what is happening in the health sector. That is tragic. That is a gaping show of lack of leadership. What is happening then is nature abhors a vacuum. We're seeing Raila Odinga almost acting as Prime Minister of the current government and giving answers on behalf of government. Did he need to comment on the operations or the situation in the health sector, asking health workers to be understanding? I don't think the handshake really covers the national wage bill. I don't think it goes that far. That responsibility still goes and rests with President Uhuru Kenyatta, who needs to end his silence. End his silence, show more sensitivity to the country, respect the country by showing concern as President of the Republic about this crisis in the health sector. Silence is not a strategy.
Let me take it from where Linus has left it. One of the reasons why people every 5 years go to the polls, they, using their ballot, surrender their rights, some of their rights, and give responsibility to those they elect to lead them. One of the responsibilities they give to those they elect is to, one, provide quality and affordable health care, 2, security, 3, social amenities, and 4, an environment to do their business and to leave. So once you see a crisis like the one that we are in currently, then it tells you there's a problem with the people who are given a responsibility at the ballot to handle these issues. Because when you see the videos that we've played here of, patients, some, I've seen one in a cast on his leg, and others who are suffering, it tells you there's a problem because these people pay taxes. It is their taxes that are supposed to give them adequate and affordable health care. So the moment they can't access that, it means the person or persons they give their taxes to, which is not voluntary, by the way, it is mandatory. So the way we pay taxes in a mandatory manner is the same way services should be rendered to us in a mandatory manner. There must be, give and take. We give taxes, so we get services, and vice versa. So it tells you there's a problem. And these challenges are not new. Almost every, it's an annual ritual that doctors will strike, nurses will strike, clinical officers will strike. And what they are striking for predates every strike. Yeah. Some of these things that we see the medical personnel ask for are not new. They are things that we had them ask even previously. So this needs to be done, and probably there ought to be a new way of handling it. Instead of being reactive, is it possible to be proactive? Anticipate, this is the situation that we are in. How are the medical workers likely to respond? What are some of their needs? How do we provide some of these needs in advance so that we curtail any industrial action? Number one. Number two, whenever this happens, patients will suffer. But eventually, this industrial action will be resolved. There will be some return to work formula, some MOU, but no one talks about the people who have suffered as a result of this strike. No one talks about it. Not that we don't have deaths in hospitals every other day, but the fact that there's somebody who will not access medical care and as a result lose his life or lose a relative in the course of it is painful enough. Yeah. So these things ought to be dealt with, without any delay. Yeah. But at the same time, and lastly, Joe, hopefully these issues, the medical issues and what the workers are raising, as genuine as they are, let also not be politicized. The moment politics get into the way of these grievances, these issues, genuine as they are, they obscure the facts, and we end up having patients who are suffering while the matter is turned into a political contest.
Yeah, and politicians are very good at doing that. If one of the other disturbing things right now is what seems to be a lot of confusion about where this really should lie. First of all, there's the whole question of the 47 county governments. Health having been largely devolved means that each county government sort of does what it wants to do. So you find County A is probably treating its health workers better than County C and X and whatnot. So you find that even the strike that's going on is really not countrywide, as it were. There are some counties where it kind of has not taken place. But so you don't know whether it is the county government or it is the national government that ought to handle this one. But at the same time, you find, so the president is loudly silent. You find the former prime minister speaking out of turn like he did this past couple of days. The deputy president seemingly talking to some other people to deal with it, and he's, from the last time we checked, still part of government. So there's no one who really wants to say this is, that thing they used to say, the buck stops here. That confusion. Is someone taking advantage of the fact that health is at two levels? There's the two levels of government.
And I think that's one of the issues that the doctors had been raising, even with the previous administration at the helm of the KMPDU, with respect to devolution. In fact, one of the 11 demands of the KMPDU is that the doctors in two counties, Laikipia and Kirinyaga, are reinstated. We all remember the very nasty exchanges we saw between doctors and Governor Waiguru. I think when they went on strike, she sent all of them home.
Actually, even a committee sitting today issued fresh orders for reinstatement of these doctors. Yeah.
And even when you take a look at the statement that was released, I believe it was today by the Council of Governors, which is a collective body, even they acknowledge that, the situation is not the same in all counties. They even then put some of the responsibility on the national government, because we know, there's the national and the referral hospitals that are at that level. Furthermore, there were some doctors who were hired under the UHC program, who were then repurposed into COVID, and I think that's where there's quite of the dispute that is centered. So who would be responsible ideally for these doctors under the UHC program, which is a national program but is being implemented at the county level? And I think this strike is actually is raising some of those issues about devolution of health and whether it should fully be at the national government or at the devolved units, and many take advantage, of this issue. In fact, the Council of Governors saying for the health workers in the national government, our advice is the same. Let the grievances be addressed at the national level with the respective relevant union. As you're all aware, the doctors went to court. The court directed the industrial action by the doctors be suspended. And here's another thing to just pick up on the contempt that Linus was talking about. Isn't it interesting that the government will always run to the courts whenever a strike notice is issued, rather than actually sitting down with the union officials to say, what is the issue? The first thing will be to go to court and seek these orders. Are they conservatory or injunction?
And those orders are actually followed in that instance. And the orders
are usually followed. However, the orders are never followed when it comes to collective bargaining agreements that are signed. Another thing I think that brings a lot of anger to this issue is the fact that we're staring at a country that has a scandal. In fact, just today, the Auditor General continued to maintain that COVID-19 supplies were riddled with irregularities and fraud. By the way, monies that were meant to hire the doctors were redirected towards procurement. And so these are some of the questions that many Kenyans continue to ask. There's allegations of certain legislators being involved in this tendering processes. And for all that saw what happened on social media with the leaked payslip of Dr. Mugusu, it is very clear that his salary and those of others have delayed. That payslip, in poor taste, was issued on the day Dr. Mugusu died. And you can clearly see that there is months of arrears. For basic salary and a number of these issues. And these are some of the things. Look, they could ask for a number of other things like a Health Services Commission, but I find it unacceptable, which interestingly was removed from the BBI report.
And now it's not there.
But one of the basic things that the doctors are asking for is pay. Just basic salary for work done for 30 days at a very critical time. We can talk about the Health Services Commission and those being other lofty ideas that we hope to live up to, but it should be unacceptable that people have to go on strike and protest to be paid a salary.
And it's important to note here, Joe, that workers in at least 20 counties do not have enhanced NHIF cover. Even as the CS was saying, there's a multi-team being that is looking into their grievances. And this is one of the grievances that the workers have, a lack of cover. That's one of the reasons they're giving for going on strike. So it's actually quite painful.
A very sick story indeed. All right, so we're taking a short break. News Gang will be right back. Remember that BBI story, those signatures went to the IEBC today. We'll take a look at them.